Many theories try to explain human behavior, health, and mental illness. The theories we will look at are psychoanalytic, developmental, interpersonal, humanistic, behavioral, and existential. Freud developed the psychoanalytic theory in the late 19th and early 20th centuries. This theory believes that all human behavior is caused and can be explained. Freud believed that repressed sexual impulses and desires motivate much of human behavior. His initial ideas were developed from experiences with clients, all of whom were women that displayed unusual behavior. The symptoms had no physiologic basis, so Freud considered them hysterical or neurotic behaviors of women. After years of working with these women, Freud concluded that the problem stemmed from childhood trauma or a failure to complete tasks in psychosexual development. He felt that these women had repressed their unmet needs, sexual feelings, and traumatic events, and the behaviors came from the unresolved conflicts. Freud felt that there were three personality components: the id, the ego, and the superego. Id is a part of a person's nature that reflects basic or innate desires like pleasure-seeking, aggression, and sexual impulses. The id looks for instant gratification, causes impulsive behavior, and has no regard for rules. The superego is the part of nature that reflects moral concepts, values, and social expectations. The ego is between the id and the superego. It represents mature adaptive behavior that allows a person to function successfully. Freud believed that the human personality functioned at three levels of awareness: conscious, preconscious, and unconscious. Conscious is the perceptions, thoughts, and emotions that exist in the person's awareness, like feeling happy or thinking about a loved one. Preconscious thoughts are not currently in the person's awareness but can be recalled with some effort, like an adult remembering what they did as a child. The unconscious thoughts and feelings motivate a person even though the person isn't aware of them. These are your defense mechanisms and instincts. Freud theorized that people repress traumatic events that are too difficult to remember. Freud also believed that much of what we say and do is motivated by our subconscious thoughts and feelings. A Freudian slip describes a slip of the tongue, saying, "You look portly today," instead of "You look pretty" to an overweight friend. He felt that these slips were not accidents, but were subconscious thoughts that accidentally came out in casual conversation. He also felt that dreams reflected a person's subconscious and had meaning. Dream analysis is a primary technique in psychoanalysis that involves discussing dreams to discover their meaning and significance. Ego defense mechanisms are methods to protect the self and to cope with basic drives or emotionally painful thoughts or events, like denial for a person who has a terminal diagnosis. Please make sure that you read Table 3.1 on pages 43 and 44 in your book and review the ego defense mechanisms. Freud believed that sexual energy, or libido, was the driving force of human behavior and had 5 stages of psychosexual behavior. The oral stage is from birth to about 18 months, and the mouth, lips, and tongue are the major site of gratification, things like biting and sucking. The anal stage is from about 18 months to 36 months, with the anus and the surrounding area as the major source of interest. Kids at this age gain voluntary sphincter control. The phallic or Oedipal phase is from about 3 years to 5 years, with the genitals as the major source of interest. Masturbation during this phase is common for both boys and girls. Penis envy can be seen in girls, and the Oedipal complex is seen in both boys and girls. The latency period is from about 5 years to 11 years. With the resolution of the Oedipal complex, the sexual drive is channeled into socially appropriate activities like school and sports. The superego is formed during this phase. The genital phase is from about 11 to 13 years, and it begins with puberty and the biologic capacity for orgasm. The capacity for real intimacy begins in this phase. Freud developed the concepts of transference and countertransference. Transference occurs when the client puts the attitudes and feelings that they have experienced in other relationships onto the therapist. Countertransference occurs when the therapist puts their attitudes and feelings onto the client. Today, psychoanalysis focuses on discovering the causes of a patient's unconscious thoughts, feelings, and conflicts that cause them anxiety, and to help them gain insight into and resolve these conflicts. The therapist might use techniques of free association, dream analysis, and behavior interruption. Psychoanalysis is still used today, but on a limited basis. It's lengthy with weekly sessions over several years. It's also very expensive and it may not be covered by insurance. Erik Erikson was a German-born psychoanalyst who extended on Freud's work on personality development across the lifespan. He came up with 8 psychosocial stages of development with a life task in each stage that a person needs to complete for their well-being and mental health. These tasks allow the person to achieve life's virtues, and you can find them on Table 3.3, page 46 in your book. The first stage is trust versus mistrust. That happens in infancy. Autonomy versus shame and doubt is the toddler years. Initiative versus guilt is preschool. Industry versus inferiority, school age. Identity versus role confusion is adolescence. Intimacy versus isolation in young adulthood. Generativity versus stagnation in the middle adult years. And ego integrity versus despair in maturity. Jean Piaget explored how intelligence and cognitive functioning develop in children. He believed that human intelligence progresses through a series of stages based on age, with each successive stage demonstrating a higher level of functioning than the previous ones. He had 4 stages, and they're on page 46 in your book. The first is the sensory motor stage from birth to about 2. The pre-operational stage is from about 2 to 6 years. Concrete operations is from 6 to 12 years. And formal operations is from 12 to 15 years and beyond. Harry Stack Sullivan was an American psychiatrist who extended the theory of personality development to include the significance of interpersonal relationships. He believed that personality involves more than individual characteristics. He felt that unsatisfying relationships would produce anxiety, which was the basis for all emotional problems. Sullivan's greatest contribution to mental health is the recognition of the importance of interpersonal relationships, and he came up with 5 life stages. They are on page 47 in your book. The first stage is infancy. It's birth to the onset of language. The childhood stage is the onset of language to about 5. Juvenile stage is from 5 to 8 years. Pre-adolescence is 8 to 12 years. And adolescence is puberty to adulthood. He also had 3 developmental cognitive modes of experience and believed that mental disorders are related to the persistence of one of the early modes. The prototaxic mode is infancy and childhood. It involves brief, unconnected experiences that have no relationship to each other. Adults with schizophrenia exhibit persistent prototaxic experiences. The parataxic mode is early childhood. They begin to connect experiences in sequence. The experiences may not make logical sense to the child, and the child may have to repeat familiar experiences to relieve anxiety. Paranoid ideas and slips of the tongue are in the parataxic mode. The syntaxic mode is school-aged. They're becoming more predominant in adolescence. The person begins to see themselves and the world in the context of the environment and can analyze experiences in a variety of settings. Sullivan's goal of treatment was to establish satisfying interpersonal relationships with the therapist, providing a corrective interpersonal relationship with the patient. He called the role of the therapist the participant observer. He also developed the first therapeutic milieu in 1929 with young men with schizophrenia. Milieu therapy involves the patients interacting with each other, practicing interpersonal relationship skills, giving feedback about behavior, and working cooperatively. Milieu therapy was one of the primary modes of treatment in an acute setting. Today, hospital stays are shorter, and it can be more difficult to create the meaningful relationships. However, milieu management is still a primary role of the nurse to provide safety and protection and to encourage social interaction for the patients. Hildegard Peplau was a nursing theorist and a clinician who built on Sullivan's interpersonal theories and saw the role of the nurse as the participant observer. She developed the concept of the nurse-patient relationship, which includes 4 phases. The orientation phase is directed by the nurse. It engages the patient in treatment and provides information. The identification phase begins when the patient works interdependently with the nurse, expresses their feelings, and begins to feel stronger. During the exploitation phase, the patient makes full use of the services that are offered, and the resolution phase occurs when the patient no longer needs professional services and gives up the dependent behavior, and the relationship ends. Peplau identified the primary roles of a nurse in a therapeutic relationship. First is stranger. The stranger offers the patient the same acceptance and courtesy that they would to a stranger. The resource person provides answers to questions. The teacher helps the patient to learn both formally and informally. The surrogate serves as a substitute for another person, like a parent or a sibling. And the counselor promotes experiences that lead to health. Peplau defined anxiety as the initial response to a psychic threat. She had 4 levels of anxiety, and these are important to know. Mild anxiety is heightened awareness. It allows the person to learn new behaviors and solve problems, and they are able to take in all stimuli. Moderate anxiety, there's a decreased perceptual field. They can focus only on the immediate task. They can still learn new behavior and solve problems, but they need assistance to do so. With severe anxiety, the person feels dread or terror. They can't be directed to a task, can only focus on scattered details. They will have physiologic symptoms like tachycardia, chest pain, and diaphoresis. They may feel like they're having a heart attack. Panic level, the person experiences loss of rational thought. They may have delusions and hallucinations. They may be immobile or mute. They may bolt and run aimlessly, which can hurt them. Humanism focuses on a person's positive qualities, their ability to change, and it promotes self-esteem. Humanists consider the person's past experience, but focus on the present and future. Abraham Maslow was an American psychologist who studied the needs and motivations of people. He focused on the whole person rather than one facet, and emphasized health instead of illness and problems. He formulated the hierarchy of needs using a pyramid to show the basic needs. First level is food, water, sleep, shelter, sexual expression, and having no pain. Second level is safety and security. Third level is love and belonging. Fourth level is esteem needs. And the highest level is self-actualization, or the need for beauty, truth, and justice. The needs of the lower levels must be met before the person can move on to the next level. Self-actualization describes a person who has achieved all the needs of the hierarchy and developed their full potential. The hierarchy is not stable throughout life. People can move up and down as things happen. Carl Rogers was a humanist American psychologist who focused on the therapeutic relationship and developed a new method of client-centered therapy, which focuses on the role of the client rather than the therapist. He believed that each person experiences the world differently and knows their own experiences best. He felt that clients do the work of healing, and if they have a supportive client-therapist relationship, they can cure themselves. The client is viewed as the expert on their life, with the therapist taking a supportive role, a person-centered approach, and promotes the client's self-esteem as much as possible through 3 central concepts, which are unconditional positive regard, which is a non-judgmental caring for the client that is not dependent on the client's behavior. Genuineness, or realness or congruence between what the therapist feels and what they say to the client. And empathetic understanding, where the therapist senses the feelings and personal meaning from the client and communicates that understanding. Behaviorism focuses on observable behaviors and what can be done to change behaviors rather than on how the mind works. Behaviorists believe that behavior can be changed with rewards and punishments. Ivan Pavlov performed experiments with dogs that provided the basis for his theory on classical conditioning. He thought that behavior could be changed through conditioning with external stimuli. He observed that dogs began to salivate, the response, when they saw or smelled food, the stimulus. He set out to change the salivating response through conditioning. He would ring a bell, a new stimulus, then produce food, and the dogs would salivate. He did this over and over until the dogs would salivate without seeing the food. B.F. Skinner was an American psychologist and one of the most influential behaviorists. He developed the theory of operant conditioning, which states that people learn behavior from past experiences, especially if those experiences were reinforced. Some of the principles of operant conditioning are that all behavior is learned, and consequences result from behavior, or reward and punishment. If a behavior is positively reinforced, it is more likely to recur. If a negative if a negative reinforcement is taken away, the behavior is likely to recur. Continuous reinforcement is the fastest way to change a behavior, but the behavior will disappear once the reward does. Random intermittent reinforcement is slower to change behavior, but the behavior will continue after the reward stops. Behavior modification uses positive and negative reinforcement to strengthen a behavior. Positive reinforcement occurs with attention and positive feedback, like a gold star, while negative reinforcement involves removing a stimulus immediately after a behavior, so the behavior is more likely to occur again. Token economy is designed to increase wanted behavior and decrease unwanted behavior through the use of tokens. Parents frequently do this with charts. Say the child does their chore every day. They get to mark the chart that the chore is done and get tokens at the end of the week they can redeem for a reward. Fears and phobias are conditioned responses that systematic desensitization can help with. The person makes a list of situations with the phobia from the least to the most anxiety-provoking. They learn and practice relaxation techniques and then use them when exposed to the least anxiety-provoking situation. They use the relaxation techniques to manage the anxiety and progress through their list, increasing their skills as they move up. Existential theorists believe that behavioral deviations result when a person is out of touch with themselves or the environment. Lack of self-awareness, coupled with hard criticism, prevents the person from participating in satisfying relationships. They are not free to choose from all the possibilities because of self-imposed restrictions. Existential theorists believe that the person is avoiding personal responsibility and is giving in to the demands of others. The goal of existential therapy is to return the person to their authentic sense of self. They encourage the person to live fully in the present and to look forward to the future. Many existential therapists use cognitive therapy, which focuses on immediate thought processing or how the person interprets their experience and determines how they feel and behave. If they interpret a situation as dangerous, they may feel scared and try to get away. Albert Ellis was the founder of rational emotive therapy and identified 11 irrational beliefs that lead to unhappiness, like the belief if you love someone, they have to love you back, and blame the person who doesn't return the love. He also believed people have automatic thoughts that can make them unhappy in certain situations, and used the ABC technique to help people identify these thoughts. A is the activating stimulus or event, C is the excessive inappropriate response, and B is the blank in the person's mind that they need to fill in by identifying the automatic thought. Viktor Frankl based his beliefs on his observations in Nazi concentration camps in World War II. He was curious why some survived and some didn't, and came to the conclusion that survivors were able to find meaning in their lives even in the miserable conditions that they lived through. The search for meaning, or logos, is a central theme in logotherapy. Therapists who work in spirituality and grief counseling frequently use Frankl's concepts. Gestalt therapy was founded by Frederick Perls and emphasizes identifying feelings and thoughts in the here and now. Perls believed that self-awareness leads to self-acceptance and responsibility for your own thoughts and feelings. Therapists may have clients read and write letters or journal to help put the past to rest and focus on the future. William Glasser developed reality therapy that focuses on the person's behavior and how that behavior keeps them from achieving their life's goals. He believed that people who are unsuccessful frequently blamed others, the system, or society for their problems. Reality therapy challenges people to look at ways their behavior stops them from achieving their goals. A crisis is a turning point in a person's life that produces an overwhelming emotional response. People have a crisis when there's a circumstance or a stressor that can't be managed with their normal coping skills. There are 4 stages in a crisis. Exposure to the stressor. Anxiety increases when normal coping skills are ineffective. All possible efforts are made to deal with the stressor, including new coping methods. When all coping attempts fail, the person experiences disequilibrium and significant distress. There are 3 categories of a crisis. A maturational crisis are predictable events in the normal course of life, like leaving home, getting married, beginning a new career, going to nursing school, and having a baby. A situational crisis are unanticipated or sudden events, death, the loss of a job, an illness. And finally, an adventitious crisis or a social crisis. This includes things like natural disasters, war, terrorist attacks, and rape. A crisis is self-limiting and usually lasts 4 to 6 weeks. At that time, the crisis is resolved in one of three ways: a return to the pre-crisis level of functioning, functioning at a higher level, or they start to function at a lower level. The first two are positive, the third is negative. Early intervention is associated with better outcomes. Crisis intervention techniques include directive interventions. These are designed to assess the person's health status and to promote problem solving, raising the person's self-awareness by giving feedback about their behavior, and directing the person's behavior by suggesting courses of action. Supportive interventions deal with the person's need for empathetic understanding, like being a sounding board, encouraging them to discuss their feelings, and affirming their self-worth. Community mental health treatment, or outpatient therapy, has many benefits. It allows the patient to continue working and to stay connected with their family, friends, and other support systems. It takes into account that personality and behavior patterns develop gradually over a lifetime and can't be changed during a short inpatient stay. Peer counseling, advocacy, and mentoring are all showing positive results. Inpatient treatment is the last mode of treatment in mental illness. It's needed in some cases where the person is severely depressed or suicidal, severely psychotic, experiencing alcohol withdrawal, or displaying behaviors that require close supervision in a safe place. Individual psychotherapy brings about change in a person by exploring their feelings, attitudes, thinking, and behavior. It involves a one-to-one relationship between the therapist and the patient. Patients want this kind of therapy to help understand themselves and their behavior, to make personal changes, to improve interpersonal relationships, or to get relief from emotional pain. The therapist-patient relationship goes through similar stages as the nurse-patient relationship, and it's key to success in this kind of therapy. The therapist's beliefs influence their style of therapy, so a patient may need to search to find one whose beliefs and style match their own. A group is a number of people who get together face to face to work together toward their goals. Each person in the group can influence and be influenced by the others. Members contribute to the group with the expectations of benefiting from it. Groups are established with a purpose in mind, such as completing a project or for therapy. Groups develop in stages. The pre-group stage, this is when members are selected, the group purpose is identified, and the group structure is addressed, things like when and where they're going to meet, how often, who the group leader is, and the rules of the group. In the beginning stage, this begins as soon as the group starts to meet. The group purpose is discussed, the rules and expectations are reviewed, and the group members can check out each other and the leader. In the working stage, this begins as members focus on the purpose of the group. The group characteristics start to emerge, whether it's going to be a cohesive group or a competitive group. Termination actually occurs before the group disbands. The work is reviewed with focusing on the accomplishments or the growth of the group members. Groups usually have an identified leader, someone who leads the group. Therapy groups usually have a designated leader, while support groups and self-help groups may have an informal leader. Effective leaders focus on the group process as well as the group content. The group leader may give feedback and suggestions, encourage participation, clarify thoughts and feelings, summarize progress, and facilitate the group through the group stages. Roles are the parts that members play within the group. Some roles facilitate the work of the group, while others can hinder the process or outcome of the group. Growth-producing roles include the information seeker, opinion seeker, information giver, and the energizer. Growth-inhibiting roles include the monopolizer, aggressor, dominator, and critic. In group therapy, clients participate in sessions with a group of people. The members share a common purpose and are expected to contribute to the group, both to benefit others and themselves. Being a part of the group gives each person an opportunity to learn new ways of looking at a problem, learn new coping skills, and to learn new interpersonal skills. Therapeutic results of group therapy include gaining new information, gaining hope, interacting with others, feeling accepted and belonging, becoming aware that they're not alone and that others share the same problems, gaining insight to their problems and how they affect others, and giving of themselves to benefit others, or altruism. Therapy groups differ in purposes, degrees of formality, and structure. Psychotherapy groups, the goal of this group is to learn about their behavior and to make positive changes by interacting and communicating with others as a member of the group. They may be organized around a diagnosis or an issue. These groups are usually formal, with one or two therapists as a leader. There's two types of groups. Open groups are ongoing and run indefinitely, allowing members to join and leave as needed, and closed groups keep the same number for a certain number of sessions. Family therapy. This is a group therapy for the patient and their family members. Goals include understanding how the family dynamics contribute to the patient's psychopathology, using the family's strengths and resources to change maladaptive family styles and to strengthen family problem solving. Usually one family member is the initial client, but therapy can show multiple members with emotional problems and difficulties. Family education. This was developed by NAMI, or the National Alliance on Mental Illness. It's a 12-week family-to-family education course taught by trained family members. Curriculum focuses on schizophrenia, bipolar, depression, panic disorder, and OCD. The course discusses clinical treatment and teaches knowledge and skills family members need to cope more effectively. Education groups. The goal of an education group is to provide information to members on a specific issue, like stress management, medication management, and so forth. The group leader has expertise in the area. Education groups are usually scheduled for a specific number of sessions with the same members. Leaders usually present information and members can ask questions and practice techniques. Support groups. These are organized to help members with a specific problem and to help the members cope with it. The group leader explores members' thoughts and feelings and creates an atmosphere of acceptance. Support groups provide a safe place for members to express their feelings. Members are usually allowed and encouraged to contact each other outside the group meeting, and they tend to be open groups that members can leave or join as needed. An example of a support group is MAD, or Mothers Against Drunk Driving. Self-help groups. Here, the members share a common experience, but it's not a formal or structured therapy session. Most are run by members, and they do not have a formal leader. An example of a self-help group is AA. Complementary medicine includes therapies used by conventional medicine practice, or used with conventional medicine practices. Alternative medicine includes therapies used in place of conventional medicine. Using St. John's wort instead of an antidepressant is an example of an alternate medication. Using antidepressants and chiropractic massage is an example of complementary medicine. The National Center for Complementary and Integrative Health is a federal government agency for scientific research on complementary and alternative medicine. Some complementary and alternative techniques include homeopathic medicine, naturopathic, and traditional Chinese medicine. Mind-body interventions include meditation, prayer, mental healing, and creative therapies that use art, music, and dance. Biologically based therapies use things found in nature, like herbs, food, vitamins, dietary supplement, medicinal teas, and aromatherapy. Manipulative and body-based therapies are based on manipulation or movement of one or more parts of the body, like therapeutic massage or chiropractic manipulation. Energy therapies include two types. Biofield therapies affect energy fields that are believed to surround and penetrate the body, like therapeutic touch or Qigong. Reiki is a bioelectric-based therapy, and it involves the use of electromagnetic fields. It includes pulse therapy and magnetic fields. It's important to ask your patient if they use complementary or alternative therapies, as they may not want to say, or they may not think it applies. Psychiatric rehabilitation involves providing services to those with severe and persistent mental illness to help them live in the community. They're often referred to as community support services or programs. It focuses on the patient's strengths, not just on their illness. They're designed to help the patient manage their illness and its symptoms, get any needed services, and to live successfully in their community. They assist with ADLs like transportation, shopping, food preparation, hygiene, money management, etc. The programs also provide opportunities to socialize in safe, supportive environments, offer vocational training, job coaching, and support for those who want to get and keep a job. They also provide information about the illness and help with health care. Interventions are an important part of the nursing process. Psychosocial interventions are nursing activities that enhance the patient's social and psychological functioning and improve social skills, interpersonal relationships, and communication. The skills they use in mental health can also be used in other areas. Mental health issues show up everywhere. Self-awareness issues. No one theory explains all of human behavior, and no one approach will work with all patients. Become familiar with a variety of psychosocial approaches to increase your effectiveness as a nurse in promoting your patient's health and well-being. The patient's feelings and perceptions about their own situation are the most influential in determining their response to therapeutic interventions, rather than what you, as the nurse, believe they should do.